Welcome to the OI Slideshow. Today we're going to continue a series from last week, and we're going to branch off on some of the more serious side effects that can be found with OI that are not just about broken bones. Now, I do not want to diminish anybody's record. I know my brother and I used to keep count, aggravated my mom to no end, but probably number one is going to be the cardiac system. I actually had prepared a slide presentation for last week on GI and was getting ready to polish it up when I started seeing a lot of questions about cardiac issues. So if this is something we need to dive into today, that's what we're going to do. Once doctors and nurses and research scientists and even the patients started looking at OI as a whole body collagen problem rather than just a bone disease, the severity of the collagen corruption became much clearer and a lot more disturbing. Now, the important caveat to remember is that on a whole, most adults, even with OI, are not going to find themselves waking up one day with severe cardiac issues. And of course, the risk does vary by your OI type and severity, but the literature over the last 25 years does point to a pretty consistent group of cardiac issues that are certainly worth watching for. Following is going to be my top 10 based on frequency, clinical importance, and the repeated appearance in group studies, reviews, and even case series. Number one, mitral valve regurgitation. Your doctor's going to probably tell you got a leaky valve. It's also probably the most repeatedly described cardiac abnormality that's associated with OI. Because type 1 collagen is an important structural component of heart valves, the valve tissue can start to become more lax or structurally abnormal. This is going to let the blood leak backwards. That's not a great idea. The things to watch out for are shortness of breath with some exertions, fatigue that seems disproportionate to what you did, palpitations, a new heart murmur. Hopefully you've had some kind of a cardiac test or exam or series runs that your physician has a baseline. If you haven't, I would suggest it. That way your doctor knows what normal is. And if something new pops up, he can quickly focus on one test or the other and not have to run through the whole series in a rush. And finally, one of the things that's a attention getter for more advanced cases are swelling in the legs and the ankles. There are several different issues that can kick off swelling down there, but cardiac is the one we want to focus on really finally because that's a serious alert. This matters in OI because there have been a bunch of studies that have found that mitral regurgitation is significantly more common in OI than in the control groups, especially as we approach adulthood. Interestingly enough, left-handed valves seem to be preferentially affected. I'm sure our nurse could tell us why. I just haven't bothered to ask. She says it's important. I believe her. Now, if this is too much for you, or you need to take some time, or you've got somebody else that wants to review the information, please feel free to point them to www.theoiguy.com/FAQ. There's a shortcut there. There's one under patients. There's some under physicians. But really, take the time, examine it, print it out, take it to your doctor, ask him if it's something you should be worried about. More importantly, get a baseline study. I'll be back with you next time to explore a couple more items that we want to keep on top of. OI Guy out.